Good afternoon and welcome. My name is Kirsten Jensen and I am the Director of the Division of Benefits and Coverage at CMS. I am joined today by several of my colleagues, including Michael Tankersley, Cherie Gaskins, Melissa Musato, Ryan Tisdale, Marlena Thieler, and Michelle Weller. Thank you for participating today. As you are aware, the Centers for Medicare and Medicaid Services, or CMS, has scheduled 4 listening sessions centered on non-emergency medical transportation, or NEMT. These listening sessions have been set up so that CMS can gather your ideas on how we can improve non-emergency medical transportation services for Medicaid beneficiaries, with an emphasis on improvements to program integrity. CMS will not be making any presentations today or answering any questions, nor will our facilitation partner, MITRE. The purpose of these sessions is to hear from you, and we encourage you to share your ideas and experiences with us. We will review all the input we gather in our series of listening sessions and consider it when making updates to federal policy and operations. I want to emphasize here that we are discussing NEMT, not non-emergency transportation, or NET, as authorized through 1915C waivers. So please limit your discussion particularly to non-emergency medical transportation. Under Section 209B3 of the Section 209B3 of the Consolidated Appropriations Act 2021, Division CC, Title II, CMS was directed to convene stakeholder engagement meetings to facilitate discussion on shared learning about the leading practices for improving Medicaid program integrity within NEMT services. CMS is very interested in your input on identifying the ongoing challenges to Medicaid program integrity, as well as the leading practices to address these challenges. MITRE is facilitating these listening sessions on behalf of CMS. MITRE operates the Health Federally Funded Research and Development Center, or the FFRDC, for CMS. I would now like to hand the session over to Jeff Goldman from MITRE, who is facilitating today's listening session. And I see there might be a problem with audio here.
Thank you, Kirsten. I am Jeff Goldman with MITRE, and I too would like to welcome everyone that has joined today's session. The purpose of today's session is to gather your input related to program integrity, correct billing concerns, documentation, and data requirements for NEMT or non-emergency medical transportation providers. As Kirsten mentioned, there will not be any presentations by CMS or MITRE, nor will there be any question and answer period during today's session. We very much want to hear your ideas on how CMS can make improvements to the non-emergency medical transportation program through federal policy or operational changes. Before we begin, I have a few housekeeping notes. Please be aware that this session is being recorded for note-taking purposes. By remaining in this public session, you are consenting to being recorded. All chat comments will also be captured. For any press that have joined today's call, we kindly ask that you please remember to communicate through cms.gov/newsroom. As a reminder that if you have any technical questions or difficulties, please reach out directly to Jay Elmore with CMS Moderated Services, either via the Zoom chat or via his email at j.elmore@cms.hhs.gov. And I ask that somebody put that in the chat so folks have that email address. All participants will be muted throughout the listening session until called upon by the moderator, Jay Elmore. Please note that once the moderator calls on you and announces that you are unmuted, you will also have to be sure that your line is unmuted. You can provide input on non-emergency medical transportation, leading practices and challenges in two ways. You can raise your hand, or you can use the chat feature. To verbally provide comments in this listening session, you use the raise hand feature. On the menu at the bottom of your Zoom window, you will see a raise hand icon. Click the raise hand, you'll be placed in the queue, and when it's your turn to speak, your name will be called and you will be unmuted by the moderator. Today's session has 10 sections. The first is for general comments on today's topic: program integrity, correct billing concerns, documentation, and data requirements for non-emergency medical transportation providers. That section includes all 9 subtopics. We will stay on the general topic until that queue is emptied, at which time we will move on to any remaining subtopics as time allows. You are encouraged to raise your virtual hand and offer comment or response to comments in any or all of the sections. You may use the chat function to offer your input as well. We will not be using the question and answer feature on today's call. Please provide any written feedback you have in the chat function. Due to the large volume of participants in today's session, we ask that you keep each of your comments to 2 minutes or less. We would like to prioritize the open phone lines for new comments. We encourage you to share your support for other participants' comments in the chat feature. Comments will be selected in the order by which hands are raised. We will try to get through all participants in the allotted time, so please keep, again, your responses concise and unique. We may decide to ask for specific comments on one of the subtopics if we have not heard comments on that topic during the general session that we will open with. Your participation in this listening session is voluntary, and there will be no individual benefit from your participation, nor will there be any negative effects if you decide you do not want to participate. We would like to hear your honest input about the topics and subtopics. There are no right or wrong responses to the topics. We encourage you to speak openly and honestly. You can choose not to respond to a specific topic or subtopic. You can also end your participation in the discussion at any time. We have allotted up to 75 minutes for the discussion today. So today's session, as we said, is focused on program integrity, correct billing concerns, documentation, and data requirements for NEMT providers. As a reminder, we ask you to keep your comments to 2 minutes or less when you are called upon, to allow as many participants to participate as possible and be able to share their feedback. Now, we will open the session for discussion and comment. Again, today's general topic is program integrity, correct billing concerns, documentation, and data requirements for NEMT providers, as well as in the opening section, all comments related to that or any of the subtopics that you'll see on the screen or that I will read off in a moment. So the subtopics that we are particularly interested in are no-show payment, no-shows, payment for missed NEMT appointments, no-shows for rides, no-load trips and or miles, trips for non-medical services, trips to nowhere, late pickups and or driver no-shows, upcoded services and exaggerated miles, inappropriate unapproved transportation for family members, patient brokering kickbacks, etc. So we will now open the floor for those that have raised their hand to comment on the overall general topic or any of the subtopics. And again, we will stay on that queue until all comments are heard before moving into any focused subtopics later on. Thank you. And I will turn it over to Jay to call on our first callers.
All right, hello everyone. Our first caller that we will be choosing on today is Judith Potter. You have not been allowed to speak.
Hi, can you hear me now?
Yes, we can hear you.
Okay, great. I have two topics and I'll make it quick. First is advisory councils. Many of the issues surrounding program integrity can be identified back to the lack of communication between the parties. The root causes of late pickups, no-shows for rides, trips to nowhere arise from the key parties not having a vehicle for open and direct communication with each other. Mandated advisory councils, at least at the state level, would resolve many of these issues. A fundamental problem in many state NEMT programs is a lack of communication between parties overseeing, relying on, and providing NEMT to beneficiaries. Some state regulatory agencies take the position that they have no relationship with NEMT providers. That relationship resides between the broker and the NEMT providers. However, this position is counter to the principle that the regulatory agency oversees the program and there almost by default must maintain an open relationship with the very people actually providing the transportation to its members. We encourage CMS to require state agencies to establish advisory councils consisting of the Division of Medicaid, brokers, MCOs, NEMT providers, and if desired, caseworkers, medical facilities, and beneficiaries. Councils should be limited to 1 or 2 representatives from each group. My next subject is state regulatory agencies should be required to perform digital audits. NEMT providers need consistent documentation and standardized data requirements for reporting DRIP information. CMS needs to push state Medicaid agencies to adopt standards to utilize digital audits to be able to identify in real time. Therefore, eliminate such items as upcoded services, driver no-shows, late pickups, exaggerated miles, transportation of unapproved friends and family members. These audits will also serve to highlight errors and beneficiaries with frequent abuses in the system, such as high no-show rates, missed appointments, and potentially identify patient brokering issues when beneficiaries are transported long distances for services that could be attained locally. NEMT providers working with NEMT and the Transportation Alliance to establish requirements, standards for reporting digital information. These teams include not only NEMT providers, but also brokers, paying sources, and state regulatory agencies. Once standards are set, state regulatory agencies and/or brokers should be able to easily perform desktop audits of submitted data in almost real time to ensure program integrity. Black and White Transportation out of Toledo, Ohio, does this with 2 agencies now. We give them limited access to our dispatch system where they use the booking numbers to be able to look at past, present, and future trips during their audit. They can see trips in real time and they can check mileage, signatures, and any facet of completed trips. State regulatory agencies should also utilize the capabilities of NEMT CredX to audit, again, in real time, credentials of drivers, vehicles, and NEMT providers. Thank you.
So next is Dan Reed. You have now to talk. Dan Reed, oh, there you go.
I'm sorry, I just got a message to unmute. My name is Dwight Kynes. It sounds like you're calling on Dan Reed, though.
Okay, yeah, it says that your name is Dan Reed. Dan Reed on here, but there you go. You can talk.
Okay, thank you very much. My name is Dwight Kynes. I'm with Z-Trip in the Washington, Baltimore area. We're in 26 cities and about 14 states around the country and do thousands of Medicaid trips per year. The point I want to make today is that TNCs do not result in the cost savings to Medicaid programs often touted in recent literature. A major fallacy that is often repeated is that TNCs can perform trips cheaper than other more qualified NEMT providers, and therefore TNCs will result in a cost savings to Medicaid programs. First of all, the introduction of TNCs to provide lower cost trips often improves the margins for the brokers for the brokers with no real savings to the state Medicaid program, especially in those instances where capitated rates are in effect. Secondly, many studies that have looked at the supposed cost savings achieved by TNCs have examined only one side of the equation, and that's TNCs doing ambulatory trips at cheaper rates, but fail to factor in the very tangible increase in costs that must occur for other trips. Remember that current NEMT providers do trips needing a higher level of service, such as wheelchair and stretcher trips, for less than the market rates. If all or even a good portion of those easy to perform trips are allocated to TNCs, then NEMT providers will have to either raise their rates for all remaining trips to maintain a level of profitability or cut costs by skimping on training, safety, and other areas, which nobody wants. Lastly, this focus on one factor of the TNCs performing these ambulatory trips at cheaper rates completely overlooks the intangible cost of sacrificing safety and training standards and other factors that are valued by beneficiaries, such as the ability to contact a local person if there's an issue with a trip or when information is needed. Thank you.
All right. Eddie Newsom, you are next. Eddie Newsom, you've been allowed to speak. All right, Eddie Newsom, are you there? If not, I will go ahead on to the next person. All right. Next is Judy Swanston. You are now allowed to talk.
Hello, this is Judy. Can you hear me?
Yes, ma'am.
Great. Thank you so much. My name is Judy Swiston. I'm president of Hampton Roads Transportation located in Norfolk, Virginia. I'm going to speak on some of the problems that we are having that go right to the heart of the program and its integrity, but also I'd like to offer some solutions to those areas. First, the brokers refusing to pay for no loads, and second, brokers arbitrarily delaying or denying payment for trips conducted. As for no loads, the riders face no financial penalty if they do not ride. Transportation providers such as ourselves, we confirm that the passengers are going to ride the day before. We get there, we call, and if the rider does not ride, the transportation provider endures the penalty. Brokers are the best people and are in the best position to absorb this cost, as they have reliable data as to the number of percentages of no loads and can bill the cost into their proposals for the Medicaid transportation contracts. So what we propose is that the CMS should enact a regulation that for each no load provider, they would receive a percentage of the anticipated compensation for the trip or a flat amount based on the distance traveled to cover the expense of going to the pickup point, using up our time, our energy, our gas, and to replace some portion of that lost revenue. The second area I wanted to speak about was the brokers arbitrarily delaying or denying payments for trips. Because of the large amount of non-payments, we have had to file suit not once, but twice against brokers to obtain compensation for trips that we have already conducted. Because of the legal and administrative expenses, we received a fraction of what we were owed. Although I would like for the CMS and the state agencies handling Medicaid trips to provide more oversights of brokers to address these problems, I understand that everyone is spread too thinly for this to be a realistic solution. So I propose 2 changes that would give brokers more incentive to treat transportation providers fairly. First, enact a regulation that allows each transportation provider to recover its legal fees and costs if it prevails in a suit for unpaid compensation from a broker. And second, enact a regulation that prohibits retaliation for complaints related to non-payment and allow providers to recover legal fees and costs as well as punitive damages if they establish retaliation, similar to the laws prohibiting retaliation for complaints of discrimination in the workplace. Thank you so much.
Eddie Newsom, you can now speak. Khalees Burton. Casey.
Hi,
Apologies.
oh, you're fine. This is
Yep.
Casey Fujeri. I'm here for the Medical Transportation Access Coalition, or MTAC. MTAC is a diverse coalition made up of transportation brokers, transportation providers, managed care organizations, patient advocacy groups, trade associations, and others. I'll make brief comments here, and then MTAC will also be submitting written comments. So I'll begin by noting that MTAC members, along with states and other stakeholders, have undertaken major efforts to improve program integrity in recent years. Improvements have been driven in large part by the shift towards brokerage and managed care carve-in models, along with advances in and increased use of technologies like GPS. The transportation broker model has been shown to greatly improve states' oversight of NEMT because it allows states to tap into brokers' experience, staffing resources, and utilization management tools. Despite these improvements, however, it's clear from recent OIG audits and media reports that more can be done to improve program integrity. In MTAC's view, efforts to improve program integrity should not only include preemptive efforts to curb waste, fraud, and abuse, but must ensure beneficiaries have access to needed services. And with that in mind, MTAC has identified several recommendations to improve NEMT program integrity. And I'll note that as a broad-based coalition, you will likely find a variety of perspectives among members on this topic and some of the subtopics that CMS has identified for discussion. First, NEMT should be included in performance-based payment arrangements that can be used to incent improved service and attention to program integrity. Second, NEMT programs should be encouraged to leverage technology, including low-cost and accessible GPS and driver tracking systems, and more advanced technologies such as machine learning technology where practical. Third, improve complaints processes for beneficiaries. Complaints processes are necessary to ensure that beneficiaries receive the services they need and that the state is able to conduct effective oversight. They should be predictable, fair, and accessible. Fourth, we're supportive of CMS issuing new guidance or updates to the state Medicaid manual regarding NEMT program integrity. Any standards that CMS sets should clearly speak to minimum requirements and provide additional direction or guidance that states can use to build out specific requirements without being overly prescriptive. And finally, while we support any initiative that advances program integrity, it's important to consider unintended consequences of any potential programs as well as any potential cost shifting. Thank you, and we appreciate the opportunity to comment.
Great. All right. I wanted to make one more reminder to everybody that once I unmute you all, you guys will also have, well, once I allow you guys to unmute, you guys will have to unmute yourself once I allow you to. So we will go on to the next person now, Terry O'Teal. I will now allow you to speak and you can go ahead and unmute.
Thank you very much. Terry O'Toole at a Kansas City Transportation Group. And I want to talk about how brokers should be required to show how quality actually factors into trip allocation. All too often, Medicaid trips are allocated by brokers, and they're seemingly allocated based upon the lowest cost provider, although nobody wants to admit that often, with little weight put on the quality of an NEMT provider. Often this results in greater overall cost to the Medicaid system. This has been shown time and again. When beneficiaries miss medical treatment because of a driver no-show, and then end up with more complications, more expensive treatment is required. Focusing primarily on low-cost providers leads to the use of lower quality providers along with lower cost. Therefore, late pickups, driver no-shows, missed NEMT appointments. Additionally, low-cost NEMT providers often have not made the investment into systems to maintain proper documentation of data requirements, leading to a breakdown in program integrity, affecting all providers. So NEMT providers cannot continue to strive for and be expected to provide best-in-class service when under the broker, they are often quite effectively penalized for having a rate structure that reflects the cost associated with the higher quality level of service. All of us who do this stuff right know what it costs and what that's going to cost us year over year. It gets divided into the trip. When a provider spends money to put in high quality training, vehicles, and systems, then requests rates from the brokers that reflect the value received by the beneficiaries for those higher quality attributes, the NEMT providers quite often told that the higher prices will result in trips being allocated again to providers with lower rates. Lower rates oftentimes follow lower service levels and safety levels. And it's a misnomer to say that the broker is simply fulfilling a fiduciary responsibility to find the lowest cost transportation, because as we know, often any cost savings from paying less for the trips to the provider does not result in any actual savings to the program, because the broker is paid on a capitated rate and is not impacted by the broker saving money by paying less to low-cost providers. The whole notion completely discounts the real cost of the program associated with having trips performed by NEMT providers with lower standards for safety, quality, and reliability. Brokers should not be able to hide behind a black box algorithm, as they tell us often, that determine how trips are allocated to brokers. We urge CMS to require states to require brokers to disclose the methodology and algorithms used to allocate trips to NEMT providers. Brokers should be required to publicly substantiate how they account for such attributes as safety, quality of training, quality of performance, and other factors into the allocation besides just price amongst the NEMT providers. I thank you for having this meeting. I appreciate you letting me speak.
Matt Holdbrook, you are now allowed to speak. You can go ahead and unmute. Matt Holdbrook. If you're there, go ahead and unmute. If not, we'll go ahead and go on to the next person. Bill, you can now unmute.
Can you hear me?
Yes, sir.
Hi, my name is Bill Scalzi. I'm owner of M7 Transportation in Connecticut, providing NEMT services for over 34 years. Roughly 50% of our fleet is wheelchair accessible. A major goal of all NEMT stakeholders should be to get the beneficiary to their appointment on time and return them in a timely manner. The timely return is especially important for dialysis patients. In order to reduce and even eliminate missed NEMT appointments, no-shows, no-load miles, trips to nowhere, and the like, NEMT providers must be allowed to make certain decisions in the field, such as a last-minute change to the appointment time or adjusting return times for patients who haven't even completed their appointment yet. Why is this important? because the healthcare industry is a very fluid environment. Appointment time changes, and assuming the NEMT is meant to be a patient-centric service, we should adjust our transportation program to match the healthcare facility's needs so we can act in the best interest of the patient. In all my years providing this NEMT service, one of the biggest consistent complaints from healthcare facilities is our inability to accommodate these last-minute time changes. When discussing data requirements for this service, you should know that our industry has the technology not only to accommodate these last-minute changes, but also record all relevant data points in the process, from booking the ride to passenger pickup, drop-off, and everything in between. This means that we can reduce the no-shows, no-load miles, etc., and also produce standardized data requirements so we don't create an environment that allows NEMT providers to bill for up-coded services and exaggerated miles, or transport unapproved family members to destinations, or any other items on your list. NEMT providers should be allowed to make the necessary decisions in the field that will get the beneficiaries to their appointments without creating unchecked fraud, waste, and abuse. Quite often when providers receive incorrect trip information, the time-consuming process required to report the errors to the broker or regulatory agency and then wait for the trip information to be fixed cannot be completed in time to transport the beneficiary to their appointment or medical treatment on time. CMS needs to establish procedures to allow providers to make these real-time corrections in an effort to, one, achieve the primary goal of the NEMT programs in getting beneficiaries to their appointments, and two, avoid having the NEMT provider wasting resources and incurring zero revenue trips because trip information was incorrect when provided. Some other examples of these are the incorrect level of service was selected. In other words, the passenger needs a wheelchair transport but it's listed as ambulatory. Beneficiary has moved to a different location. Medical facilities has moved to a different location. The records aren't updated. Beneficiary's appointment time or return time is not correct. Beneficiary has not completed the medical treatment by the time of the scheduled return, and so on and so forth. Repairing these issues would result in, number one, getting Medicaid beneficiaries to and from their much needed medical appointments and treatments. Number two, preserving NEMT program integrity. And number three, assuring that NEMT providers are paid for trips performed. Thank you. I greatly appreciate the opportunity to speak on these important issues.
Anna Hall, you may unmute and talk.
Hi, my name is Ann. I'm with CTN in Fort Wayne, Indiana. I want to talk to brokers and the expense of having the broker. We, working with the broker, have had to hire a full-time staff person just to deal with the inefficiencies of the broker and the time that it takes to get the trips, look up the numbers, look up the information, all that kind of stuff, and not getting numbers and having to call them to get the numbers, things like that. And it's just terribly time consuming. We have to do repetitive reports on a regular basis. And that's another thing that just takes up extra time. We have to say who our drivers are, and then we have to say every 3 months who our drivers are. And we have to say what vehicles we have, and whether we get no vehicles or anything, no new ones, every 3 months we have to report on every vehicle. The brokers we found can change, at least ours, the cost at will. We were having issues and we were thinking of backing out, and they're like, oh, well, we'll pay you more. So we're already not, there's that huge gap between the cost of the trip and that, and then the brokers have the ability to up it and not let people know. And then we have the added costs on top of not getting fully paid for the trip for having to hire a full-time person to manipulate the system. The other thing I wanted to mention is the frustration on the client's end. We have been using one particular broker for 4 years now, and we still have clients calling because of the frustration with the process. There are things like people who have a standing order that's once or twice a week. but they have to call in every trip because they only count a standing order as 3 days. We have issues with the frustration of like a dialysis center or an ABA center who has to call in every 3 months to renew the standing order, and they get the information over, even have copied emails and replies, and it never gets put into the system. So then us as a transportation company don't want the person to not get to dialysis. So we continue to transport and not get paid for the trips. Thank you very much.
Ed, Corey, you can now talk.
Hey, Jay, can you hear me?
Yes, sir.
Fantastic. Thanks for the opportunity to let me talk. I definitely agree with what everybody's been saying so far, but I also wanted to kind of hit on one other thing, and that's trips for non-medical services. We run a small transportation company in West Virginia, and it's extremely rural. And one thing that I think is important when we're looking at the overall health for people, it's great to get them to medical appointments and things of that nature, but there's a lot of other factors that go around health, right? Such as, eating better foods or living a better, healthier lifestyle or getting more activities in. And a lot of things that I notice is when we're transporting people in our area, we're passing places like that all the time between a member's house and a medical appointment. And so I think it'd make a lot of sense for CMS to consider, offering some type of paid transportation to those other determinants of health so that that person can be healthier in the long run. And I think when people start living a healthier lifestyle and they're eating better and they have better access to more activities, plus getting better medical attention, those people will be healthier in the long run. And if you can do that on a greater scale, you then reduce the cost of the medical attention in the long run. And that's the most expensive part of all of this. So I just kind of wanted to bring that to everybody's attention and talk about how important I think that will be in the future to making sure people are healthier and that we reduce costs to everybody in the long run. Thanks for the opportunity to talk.
Okay, Jeremiah, you may talk.
All right, can you hear me?
Yes, sir.
Okay, my name is Jeremy Scalzi. I'm Director of Business Development at M7 in Connecticut. I just want to speak today on data standards, specifically GPS and digital reporting and the integrity of the program. Quite often, the issue of program integrity is exacerbated by the lack of continuity and standards of data requirements and digital documentation. So the ability to pay providers, hold those providers accountable, and hold the paying sources accountable for data integrity starts with standardizing the data and requiring digital information. So government administered transportation is actually largely facilitated by GPS tracking already. Buses and subways are largely equipped with tracking technology for reporting efficiencies, and due to that fact, there's very little fraud, waste, and abuse comparatively to the Medicaid transportation industry. And the NEMT industry actually recognizes the need for this digital reporting of information and GPS tracking. Through organizations such as NEMT and the Transportation Alliance, significant projects are already underway to obtain, track, and standardize digital information reported by NEMT providers. Equally as important, actually, the vendors supplying software to the NEMT industry should be held to the same standards. So people like brokers who are in charge of trip scheduling and dispatching should be held to that same standard. I urge CMS to reach out to these organizations to work together to set standards for reporting trip information. Consistency of information will definitely lead to things like ease of auditing trip data, reduction of fraud, waste, and abuse due to discrepancies between claims data and GPS tracking data, the monitoring of exacerbated trip miles to establish that sort of medium there. And finally, collaboration between federal and state authorities and transportation providers to improve this program across the country. Data is one of the most powerful tools in terms of decision-making in today's society. So if we have data for the entire industry that's standardized, it would be that much easier to set programs in motion throughout the entire country. Most importantly, the requirement of GPS-enabled technology does not increase barriers of entry to the NEMT marketplace. There are many, many, many low-cost solutions that offer these capabilities, so you wouldn't be blocking anyone from actually joining the industry. I urge CMS to require state regulatory authorities to require NEMT providers to report trip information via a digital interface using standardized data formats. Allowing paper logs should not be supported due to the lack of GPS and digital reporting of data. That opens the door for an opportunity for fraud, waste, and abuse. Further advancements include the NEMT Credential Exchange, or CredEx program, coupled with the standardization of digitally reported information, could really allow for real-time verification of the entire NEMT process. So from ensuring only approved and credentialed drivers are even behind the wheel, straight on through to on-time performance of that trip, everything would be monitored. So I just want to close with, the projects are currently underway by both NEMTAC and the Transportation Alliance. They include joint participation by software vendors, NEMT providers, brokers, state regulatory authorities, and other paying sources, even healthcare facilities. Everybody wants to come together to solve this issue together. So we recommend that CMS reaches out to NEMTAC and the Transportation Alliance to work with them to set, implement, and require industry standards for recording and reporting digital information for all trips. Thank you.
Wendy, you are now allowed to unmute.
Hi, this is Wendy Schrag. Can you hear me?
Yes, ma'am.
Okay, thank you. Hi, this is Wendy Schrag with Fresenius Medical Care. We have dialysis clinics across the country. And I want to just briefly mention the main issues we see, and then also follow up with things that we feel are working to help solve some of those problems. Especially when COVID was at its peak, we had problems with very few drivers transporting our COVID positive dialysis patients. Our patients still had to get to dialysis. Sometimes they had to go to other clinics that were isolation clinics. And so it was very difficult to find transportation for them when they were COVID positive. I think the things that we see now are, like most industries, workforce issues. We hear from the brokers that they just cannot find enough transportation providers. One broker recently told me that he's down about 50 to 60% providers, and especially wheelchair vans, wheelchair vehicles are hard to find. Someone earlier mentioned long waits. We hear from our patients, and we see our patients that have to wait a long time for their rides to go home after their treatments. And so that is something that we experience, as well as inconsistent or missed trips. Mileage reimbursement is really appreciated for our patients and families that can drive themselves, but we often find that they have to wait anywhere from 4 to 6 months to get their mileage checks, and so that makes a financial hardship for them. When the brokers change from one broker to another in a state, that always seems to be a very rocky transition. And finally, I would say just overall, there seems to be a lack of awareness at the state level between of the problems that are really going on. There's the state, there's the broker, there's the managed care plans, there's the drivers, there's the patients, there's the healthcare providers. So there are a lot of entities involved in this system, and it seems like there is not a lot of accountability or communication that makes it up to the state level, so that they're really unaware of everything that's going on. Ambulance approvals have also been difficult to get for our patients who have to rely on stretcher transportation to dialysis. So things that I think have worked well, we have in a number of states, we have developed monthly conference calls with the state, the brokers, the managed care plans, our dialysis staff, and that monthly communication has really helped a lot. Some of it is just relationship forming and good communication to solve some of these issues. Someone earlier mentioned advisory councils. I only know one state that does that, but I highly encourage that. Standing rides for our patients are important. Our patients always have the same schedule pretty much, and they like to have the same driver that they recognize. Sometimes our patients are scared to get in a car if there's no identification on it, or if someone comes up to their door or honks and they don't know who it is, they will not come out of their house. So driver training, identification on the cars is really important for our patients to feel safe. Some of the states brokers have a software scheduling system that we've been able to use. So if we have a patient that gets hospitalized or has a schedule change, we can enter that into the broker's software system, and that has been a big help. And then finally, I would say just having a grievance complaint system that actually works and that people get responses from. There are often complaint forms or complaint lines, but then you don't get a response back, so you don't know if it's being attended to or not. And finally, the person that mentioned the future of transportation and especially social determinants of health and meal deliveries, I highly recommend that CMS looks at that, especially meal delivery. That could be really helpful for people who have trouble with nutrition. Thank you very much for this opportunity to speak today.
Adam, you may go ahead and speak.
Can you hear me? Can you hear me? Can you hear me? Can you hear me?
Yes, sir.
On another line, but what I wanted to talk about is that I agree with most all the comments that have been made today, and I think to me, valid and verified credentials for drivers, vehicles, NEMT providers leads to the very heart of program integrity in the NEMT industry. The industry, and I think CMS should be aware, sought out to solve this several months ago. It started off as a simple project to just simplify the life of the NEMT providers by providing a credentialing exchange in which we could upload our data once instead of having to upload it to 6 different brokers, if that's who you represented. However, we quickly realized the importance and the ability to take this exchange far beyond that. We partnered with NEMT, with NEMTAC and with a company, ProCredX, to create the NEMT credentialing exchange. It's now got over 31 participants in the testing program. I believe the state of Tennessee is involved from the Division of Medicaid on down to providers, with every party in between. We have multiple state regulatory agencies involved. We have providers, we have brokers. It's a system that we're testing across the board. One of the things that we recognized early on was that when you look at the OIG audit reports that came out, a large portion of the fraud that was identified in there was technical fraud. It was fraud because things either weren't being followed or they weren't being enforced. The credentialing exchange will produce credentials that are immutable and of which have a verified provenance and can never be falsified, fraud, or whatever when a driver puts them in. It'll simplify the process of brokers switching or contract switching in states, because the credentials will be in there and a new broker can simply step right in, verify the credentials. They don't have to verify them, they've already verified. So I would highly encourage CMS to reach out to NEMTAC, to reach out to ProCredX, to find out, how they're using blockchain technology to create this credentialing exchange. It's called the NEMT CredX. It's out there, it's in the industry, it's working, and it's something that's going to make a big difference and going to lead to program integrity across the board. You can take a lot of the things that we're talking about, the digitalization of information, the continuity of brokers changing, all of that's going to be solved, or at least steps forward in solving with the credentialing exchange. Thank you. I appreciate the opportunity to talk.
All right, Robert, you can now unmute. Robert, if you're there, you can now unmute.
Thank you. Can you hear me?
Yes, sir.
Okay, thank you for allowing me to speak. My name's Robbie Worth, and I'm from the Washington, D.C. area. I've been doing Medicaid transportation since 1979. I agree with the comments of Judy Swinston concerning the no-shows. This is one of the biggest problems that transportation providers have. We incur the costs, the fuel costs, the maintenance costs, the labor costs, and the depreciation costs. And we're not reimbursed if, due to no fault of our own, the client does not avail themselves of the service. I also agree with Dwight Kynes' comments about what we call in the industry cherry picking, allowing certain companies to only transport what we call easies, the easiest transportation that can be provided ambulatory without having to consider taking both ambulatory and non-ambulatory clients. Finally, a huge issue, especially today, is fuel. You probably are going to the gas station and seeing an increase in your fuel costs of anywhere between $10 and $20 per pump. And this is magnified by transportation providers where they're not getting increases in the fees that are paid by brokers for additional fuel costs. My suggestion is that there be a requirement by the either the federal agency or state agencies that fuel be benchmarked and that increases in fuel costs be added on either a per trip or a per mile basis to cover the fuel expense of the providers. This would decrease the turnover in the industry. And as one of the speakers spoke earlier, that they only have 50% of the previous amount of transportation providers providing the service. So no shows and fuel need to be taken in consideration. Thank you.
All right, Dan, you may now speak.
You got my comments when you got in with Adam. I wasn't sure if I had got back in line in time. But I would like to make a comment regarding broker accountability that was brought on there and holding beneficiaries accountable. As an NEMT provider, I can be held accountable for fraud, waste, and abuse at any time. I think a lot of people have mentioned the notion that when I confirm a trip with somebody and then I go out and send a driver out to their location and that person tells me they decided not to go, that is a waste and abuse of Medicaid resources. So I would like to just, reiterate and agree with the person who mentioned that. It's the same thing with when I get trip data that has not been verified before it's sent to me. And I understand there's a lot of moving parts. I understand that a lot of people move around, but we get trips that are just bad data and there's nobody accountable for that other than I pay the cost of having to have my vehicle, my drivers on the clock and going out there and doing things. So I do think that there should be some accountability, brokers having to pay for missed data, data that just has not been verified at their end. And I don't know what it is because you don't want to ever deprive a member or beneficiary of medical treatment, but there has to be some way of making sure they understand the consequences of fraud, waste, and abuse of Medicaid resources by simply not going to an appointment. Thank you.
All right, George, you may now unmute.
Hi, my name is George, and I'm the chairperson for TransLink Committee Board, which sits on the brokerage. Comments I want to make is, as far as the no-shows, I've heard a lot of comments about the no-show stuff. We'd like to let CMS know and people that are having services with brokerages, people in wheelchairs that are disabled, there's nothing that we can do that is beyond our control when we have no-shows, especially when a doctor doesn't show up I would like to see CMS not give brokerages and people with no shows give them chance of not penalizing them for things that are beyond their control when it comes to people, especially with people that has a disability. Say like they have to use the restroom or whatever, that cannot be helped when it comes to no-shows. So I would like to have CMS not penalize brokerages and people going to medical appointments to be penalized. Further, I would also like to suggest on the inappropriate and unapproved transportation for family members. Sometimes family members need nurses and whatever to go with people going to doctors because of dementia and that have this disability that other people cannot understand, like blindness, deaf. They need family members to go with them. So I would like to see CMS to lighten up on that of not penalizing for things like that, along with the brokerages as well. As far as the non-medical services, in order to create an answer to all the problems it's been having, I would like to suggest to CMS to coordinate with the brokerage, the board committees like my own, the state and such, to all come together to figure out what we can do next to alleviate the problems that are happening. Also, CMS, with the federal money given to the brokerages, to have faster service through the information that we receive. Like, for example, if the CMS was to send data to brokerages, I would like to see CMS put federal money towards the brokerages to have faster service through internet or through faxes. That way, the brokerages can carry that information to providers and they're not having to wait for the person that is waiting for a ride. It will keep from drivers having to wait for people coming out of offices. That's the only solution that can happen. For that to happen is faster internet service to transport information and or faxes. Thank you.
Okay, Jonathan. You may now unmute.
Good afternoon, Jonathan Anthon from ISI Technology. We're the makers of Route Genie, which is an NEMT software platform. We serve over 300 NEMT fleets throughout the United States in 38 different states. That gives us a little bit of a unique perspective, seeing how things operate in different places in different ways. And I want to talk a little bit about standardization. I think a lot of the problems and hot topics that we're talking about, some strong data standardization could help resolve some of those things. And that data needs to be standardized in 3 different ways. The first is how trips are communicated to providers, depending on the broker or how the trip is managed. As some managed care organizations, for example, will take on the task of distributing trips on their own. We see customers with managed care organizations sending them PDF files that are unsecured via email to send trips. We see some that are spreadsheets. Obviously, there are brokers that have portals, and everybody provides different information in different ways. And sometimes that information is complete or incomplete. Sending those in unsecured files is actually, as everybody here is likely aware, a HIPAA violation, and the MCOs should certainly know better. And they're sending over information that isn't necessarily complete and able for that customer to be billed by the NEMT provider once that trip is completed. So we find a lot of providers tend to struggle figuring out how to navigate these complex billing arrangements that they have to go through in order to bill those claims, which leads to the second piece, which is standardized billing. We see different diagnosis codes across the country, different provider IDs, whether it be the Medicaid provider ID, the NPI that needs to be provided, seems to change from state to state, from payer to payer. We see different diagnosis codes being used. We actually even encountered recently a different location code. There's one state Medicaid system that requires the ambulance code to be used for NEMT, whereas most other states use code 99, which is the kind of other or generic code. There's no reason that these should be unstandardized. It should be simple and easy for every single transportation provider to use so they can be fairly compensated. The last piece is remittance. Everything seems to be remitted differently in terms of how you keep track of your payment. There is a major national broker right now that is requiring a lot of their providers to move to a digitized platform. And that broker has a major glitch in their system where trips are just disappearing from their billing system. There's no way for the provider to know that the trip was not sent to them. They do not send any sort of failure message back to their integrated software partners. Those trips just essentially vanish. So if the provider doesn't go one by one through every single one of their trips manually to make sure that that payment is there, they would have no way of knowing that that trip was never remitted. That's not fair to the providers. There are rules in place regarding remittance for medical claims, and the broker should be held to the same standard that everybody else is. So those three pieces in standardization, how trips are sent down to the providers, how trips are billed, and then how trips are remitted, can help solve a lot of problems, help the operators operate more efficiently, help make sure they're losing fewer claims for unnecessary reasons, provide better levels of service to the community. Thank you.
All right, Heidi, you may unmute. Heidi Miller.
Hi, my name is Dr. Heidi Miller. I'm a primary care doctor in Missouri, working at a federally qualified health center in St. Louis. I have just a couple of brief points. Currently, NEMT delays are so pervasive that it really makes it impossible for any patient with children or with a job to use it, because it is an all-day ordeal. So only my patients who don't have young kids or on disability are able to use it. Sadly, after a long day of clinic, when I often will see my patients still waiting in the waiting room, we will often, just out of pity for them and inability to communicate with their transportation, we will pay for a taxi out of our own bottom line, which we can't afford. I also want to echo a point of giving the choice of provider, and the continuity of a provider is key. So we have a primary care shortage, and the only thing that makes me cringe is when someone misses their appointment. And sometimes people will not make their appointment because they don't feel safe boarding. Interestingly, I had a patient who recently died of pancreatic cancer. I attended her funeral. It was a very small funeral, and it included all of her family members, 2 friends, me, and the NEMT provider, the lady who had driven her to her chemotherapy. So I think this continuity is very important, and we can't take care of our patients without team-based care, and I consider the driver the part of the team. Another point is that I've had patients who perhaps come across your screen as being a no load or not showing up. And please understand that the reason why many of the patients are coming is because they are sick. And it's not uncommon that I've had a patient cancel last minute because their vertigo was causing such severe dizziness they didn't feel safe boarding. We just need to remember the frailty of our patients. And that's it. Thank you so much.
All right, MedX Transportation, you may unmute.
Hello, this is Lamar from MedX Association. I just wanted to touch on a couple things that I found as interesting in the thing. We're like looking for hard sales on individual services in the NEMT space. And in that community, it takes a community to solve for these issues. I agree, we do have to have an advisory board. I believe that there should be software and technology. So I agree with everything that everybody's saying here, but there's one thing that's not really addressed, and it becomes down to the rule. If you start looking at the way that the rule is set up, it's designed even for the brokers to fail. In this system, the brokers are saying, hey, get the cheapest, the system is saying get the cheapest, the lowest, cost, trip, everything there. Well, then they have to kind of make their bottom line, and that trickles down to the provider, and then that trickles down to there. And then basically you get back into the quality of care. The quality of care for the person, now that you're getting unqualified drivers out on the road, it all changes. A system that is non-pervasive to that point would be something that I would like CMS to put in place. Something that's more like a trip marketplace that offers right of choice to the individual driver, to the individual member that's taking their trip. If they're very comfortable, just like the young lady was saying a minute ago, if they're comfortable driving with them, why can't they drive with that company? Why is that selected for them? You know, we personally, Medic speaks for over 3,000 provider companies that are in our association. And all these guys are saying the same thing. Why is it not centralized? Why are there different pricing points for you get a provider that's right next to you, he's making this amount of money, the other company's making a different amount of money for their trips. It's broken up. So why can't we just instead use more of a centralized highway approach, something that's learned from rideshare? A centralized approach to the trips being distributed. It would stop the fraud. It would stop all that. It would standardize credentialing, and it would be inclusive. All these companies who invested into software, why should one company be taken over top of the other one when instead we can create a community of a highway where all the companies can plug in, all the brokers can plug in, everybody can be conclusive, and even the provider companies that are comfortable using the software they signed up for, that they became a fabric of their company, could continually keep using that software. So everyone stays right in the lane that they are, but instead a system that is more inclusive to the community. It, to me, is something that definitely needs to be done. Biometrics should be used in here to weed out the fraud and validate that people are actually the person taking the appointment. Anyone that can tell you, being that myself, I was a provider, so I can tell you all the pain points for no-shows, the accountability that's necessary for a company that is going through the thing of no-shows. You get up at 3 a.m. in the morning, travel out to your place, person doesn't show up. That hurts. Who made that call? Who's responsible for the gas? Who's responsible for paying the provider? You know, for the trip, or the driver for that trip, for that case. These are things that were left out in the idea of NEMT. And there's a lot of different examples to learn from. So what I'll do, I'm not going to pitch product. I'm not going to pitch anything like that, because I think everyone that's on this call has a very valid and needed concern and has a place in the community, period. But I think that's what we have to start with. The rule in the community first. We have to put it all together, all the solutions to make one solution and become one voice and one NEMT. And I'll leave it at that.
All right, Tamar, you may go ahead and unmute.
Hi, yes, this is, can y'all hear me?
Yes.
Okay, this is Tia McCrane from Northwest Louisiana. And Dr. Miller touched on this briefly about kind of the dignity of our clients. And that's the main thing that I think really happens. We had a client that, as the previous gentleman just said, the broker went to a cheaper provider. And we are a full wheelchair accessible company. We've been transporting this client for years. He was a double amputee, goes to dialysis 3 times a week, lives out in a rural part of the Louisiana area. So definitely some time to have to get to this gentleman. This new company shows up, talked about continuity. He'd been going with us for years. He didn't know who they were. They were in a minivan, not a minivan with the wheelchair ramp, a minivan. They told him, he said, well, how do I get in your van? They said, well, just lift yourself over into the van. That right there was one strike to his dignity. And then when he came out of dialysis that day, he was very weak and he could barely get himself into the van. When they showed up on the next day, on Wednesday, he almost didn't go. But then Wednesday afternoon, or he called us Monday and said, how come y'all can't come pick us up? We said, you got to talk to your broker. You can call, you can request us, you let them know. But their theory was, we've already booked it for this week. We'll catch y'all next week. So Wednesday after dialysis, he goes to get in the van and he was so tired, he actually couldn't lift himself up and he dropped to the ground of the van. The dialysis center came out and picked him up. They then called us. How come y'all aren't coming to get him? We told them the same thing. Friday, the same company came to pick him up and he said, I'm not doing this. And he stayed home. So they took a cheaper route, but Saturday afternoon, because he missed dialysis, he was in the hospital. So CMS should look at that, the impact of how these things, when they don't truly, and I want to talk about the matching of a client's needs to what a provider can do. Not so much that we know if they don't get to their doctor's appointments, that kind of thing, but why are they missing it? This provider was not truly a wheelchair accessible vehicle. Sure, it may have been listed that in the broker's database, but the other thing is when we called the broker, they're like, we didn't know he couldn't actually walk. We just thought he used a wheelchair to get long distances. Well, you have that he's a wheelchair. Where are you making that call from the broker's end? If someone tells you they need a wheelchair accessible vehicle, you don't get to make the call on your end. We don't even seen this client. So I really think CMS needs to look at enforcing the brokers to truly match and identify as we keep moving forward. And who knows, maybe there's other options available for NEMT, but making sure the client and the provider are a match. So that way you don't have unintentional missed appointments and missed medicals. Thank you.
All right, Susan, you may now unmute. Susan, are you there? I see that you're unmuted, but we can't hear you. All right, we'll come back to you. Aaron, you may now unmute. Aaron Thomas. Okay, I see you just lowered your hand. Gil.
Hi, can everybody hear me okay?
Yes, sir.
Okay, thanks. My name is Gil Amato. I'm the owner of First Choice Ambulette in Long Island, New York. And I want to talk about brokerage and payments and pay parity. For the last, I don't know, 20 or 30 years in New York, we have had a transportation manager in New York State where all fee-for-service Medicaid trips were paid at the same rate to every single provider in every county, which meant one really important thing was that providers didn't compete on price. We competed on quality. And I think that what gets lost when you switch from a fee-for-service system with payer parity, with price parity, where every provider gets the same rate, and you go to a more broker model where rates are negotiated by the vendor, you lose quality immediately because price is the thing that we compete on instead of quality. I mean, you've heard 100 stories already about how quality is important, about how quality drives outcomes, about how social determinants of health and access to care is all driven by quality. But the minute that you take quality, you say, you know, let's just save some money, you lose the value of NEMT and the ROI that it represents to the health payers. And I think that message gets lost when people don't have boots on the ground and don't have investment in vehicles and technology that's involved in that. So I really hope that the people that are putting this together can understand that price competition in healthcare is important to keep costs down, but you have the price competition among vendors for NEMT just drives down. Thank you.
All right, that was the last hand that we had raised.
Thank you, Jay. This is Jeff Goldman again from MITRE. What we have about 10 minutes left for comments. I see one hand has gone up in the queue. I do want to call attention to, again, the list of subtopics, and in particular, the topics of trips to nowhere, inappropriate, unapproved transportation for family members, patient brokering, kickbacks, etc. But again, the floor will be open for all comments, but did want to emphasize a few areas that we believe we haven't heard as much comment on. But we'll keep the floor open for the next 10 minutes. And we do encourage anyone that has comment to make those comments now. For those that spoke from previously prepared comments, we would also appreciate if you would email those to the NEMT engagement mailbox, which has been in the chat, and somebody will put in the chat again. So I see we have two, Jay, in the queue. So if you can go to them, and again, we encourage anybody in this last 10 minutes that has any comments on our topic today to go ahead and jump in the queue.
All right. The first person we have here is Mitchell. We can go ahead and unmute.
Hey, thank you very much for the chance to talk. I'm Michelle Watkins from the Rockbridge Area Transportation System in Lexington, Virginia, very rural on the western side of the state. And one of the challenges that we frequently encounter, specific no-show, is there will be last minute, such as the evening before cancellations. Sometimes the rider may end up in the hospital unexpectedly, so the ride needs to be canceled, but we are not notified. So we have drivers who on a typical drive would drive 10 to 15 miles, get to the place of residence, and then find out, nope, we're not there, we're not going to be taking them. And when we try to go back to the insurance carrier, they say, oh, well, we notified you, and yet we can't find any indication of notification. So I think there needs to be some improved process and responsibility for who needs to do what by when, and especially with our carriers notifying the transportation providers specifically. Also, another problem we have, we do a lot of dialysis transportations every week, of course, and we have our standing riders. But and I think this was mentioned a little bit earlier, but when we have standing riders, we still have to receive prior auth, so to speak, from the insurance carriers. And if we don't receive that information timely, unfortunately, our time spots get filled up. So the insurance carrier will often call us at the very last minute, and we're not able to then transport the person. We can't reschedule the transport knowing that the insurance carrier is going to call at the last minute. The system won't allow us to do that either. So it really puts the transportation provider and the riders in a very difficult situation, relying on the carrier to maybe be more timely in the future instead of waiting till the last minute. Thank you.
All right, Sherman Pines, you may unmute.
Just a comment from New Orleans. We like to see CMS do more background checks, because we had a death due to background check not being made, where there was a car accident and the person was drunk, no identification, and they had a car accident, and the person was going to dialysis, and they passed away, unfortunately, because of someone not noticing. So we would like to see CMS do more of background checks and have their broker do more of it. Thank you very much.
All right, Julie, you may
Yeah, hi, thank you. My name is Julie Hine. I'm the Healthcare Compliance and Privacy Officer at First Transit, which is a national transportation organization, and we also serve as a broker in various states. I think, number one, first and foremost, I want to applaud all of the NEMT stakeholders working together on our current projects to improve the challenges associated with this critical service to some of our country's most vulnerable individuals. What I can say is, based on my experience, I believe overall the best opportunity to improve this space is for CMS to streamline the NEMT regulatory and compliance framework for all states, making it an even and clear ground. I think this would be beneficial to brokers and providers as a whole. It would identify clear lines of what is needed, and everybody would be able to keep things consistent. I do think that this also relates to some of the issues that were topics for today's call related to no-shows and payment and issues that transportation providers struggle. I mean, I think that we have to keep in mind, and I see this on a daily basis working with the managers and also my team that work directly with the providers on all of the things that they have to meet. But then ultimately, when they're showing up and individuals are not at the trip, and they can't complete that trip and thereby don't get paid for that trip, is really impacting our providers and their ability to continue to provide rides to this very vulnerable population. To that end, one of the things that we've started to do in our fraud, waste, abuse program at First Transit is to look at the member level potential fraud, waste, and abuse. And that includes tracking significant issues with no-shows or indication where a trip didn't happen the way that it was supposed to, and providing that data back to our MCO partners so that they have it. I think one of the things that I have found in working with those MCOs is that the actual look at member data isn't necessarily a huge priority. And I can appreciate from a financial perspective, as far as going after fraud, waste, and abuse, we're looking at the major issues and where the money is going, but preventing use of funds and making sure that they're utilized for the things that are needed, or ultimately making the programs more advantageous to this population, such as adding trips to the grocery store or trips to the pharmacy, or various things that help improve health. The money could go to that as opposed to no-shows or things of that nature. Also, it keeps our providers happy. I also want to touch on some of the information. I've heard a lot of discussion about various types of data on this call, including GPS biometrics. And, obviously we're also dealing with protected health information due to the HIPAA regulation. I think that any way that CMS this is really where the standardization comes into play. And to route Jeannie, who made this comment, I think looking for ways to make sure that we're standardizing this and looking at it, but also that CMS is taking into account where we're looking and collecting all of this data. It also relates to the members that we're transporting and does relate to the HIPAA regulation, security and privacy rule, and the potential conflicts that correspond there, as well as with the many new privacy and security regulations that are being considered and enacted throughout the country in specific states, and then ultimately potentially at a federal level. If we don't have consistency there, then we're not going to be able to make determinations. So at the very minimum, having CMS provide guidance as we're looking to improve this space on how we navigate those privacy regulations and how it relates to HIPAA is absolutely critical. Thank you.
Okay, Jennifer, you may now unmute. Jennifer, if you're there, you may now unmute. All right, we're gonna go to the next person, and we have Dan. Dan Reed.
Yeah, this is Dan. I just wanted to circle back on one comment I heard you make, that you felt that maybe we hadn't, or people had not commented on trips to nowhere and family members riding unauthorized. And I do think those were hit on in a lot of places, perhaps not as clearly, or maybe the problem wasn't as obvious. But I think it was Bill Scalzi who might have mentioned that letting providers solve problems and not have to try to go through the process of going back through a broker or the payer to solve the problem. And quite often that can't be done in a timely manner. So giving providers, especially now that we have the technology in our vehicles, in our systems, to document why we did that. I believe it was another lady mentioned that sometimes family members have to go, and that might have gotten left off a trip. and then a provider is faced with the choice of, do they technically violate Medicaid rules by taking somebody who's not authorized, or do they get somebody to an appointment that they need to get to, and do you do it in a way that makes it safe for that person? So in many ways, I think a lot of those topics were addressed. I think that it's a very complicated piece, but the idea is that if the goal is to get the person to the appointment, then we need to make sure that all the rules are focused on allowing the people who do that transportation to get someone there safely and then get them back home safely. Thank you very much.
This brings us to the conclusion of today's listening session. Thank you. I apologize if anybody was in the queue that was not able to speak, but there is definitely opportunity to still provide your comments through our mailbox at nemtengagement@miter.org. Just as a reminder, today's session was recorded for note-taking purposes. If you have any additional comments that you were unable to share today, please feel free to email them. Also, if you spoke from prepared comments, email those to us as well. We would greatly appreciate it. We appreciate your joining us for this second NEMT listening session today and for providing your valuable feedback and comments. In addition to today's listening session, there are still 2 more sessions over the next several weeks. These sessions are Economic Factors and Cost Containment Challenges in NEMT, which will be next week, Thursday, April 7th. NEMT Coordination Topics, Brokers, MCO Community Transportation, and Paratransit Services on Wednesday, April 13th, so 2 weeks from now. If any of these other topics are of interest to your organization, please go to medicaid.gov to register. The direct link is listed on the slide. We will also drop the link into the chat so you can pick it up from there. Again, we are at the conclusion of our time. We thank you very much for your participation today. All your comments will be considered, and we look forward to hearing from you again in a future session. Thank you and have a great day.